World Neglected Tropical Disease Day, which is January 30th. My name is Bea Spadaccini, and I manage the Health Journalism Network for Internews. This is a global and dynamic network of journalists and media professionals who are passionate about covering global health and improving the quality of health journalism worldwide. This is a network of approximately 1,800 journalists from 85 countries. And if you're a journalist or a health communicator, you're welcome to join. It's free. And my colleague Catherine Cleary is going to post the registration link for you to join the network. It is now my pleasure to introduce you to today's moderator, award-winning freelance health journalist from Nigeria, Nike Adebo-Wale Tambe. For the past decade, Mrs. Tambe at Nike has dedicated her career to raising awareness and fostering understanding about health issues that often go overlooked. Her insightful reporting and engaging storytelling have been rewarded with numerous recognition, both locally and internationally. Notably, one of her groundbreaking reports that capture global attention delved into Noma, a recently acknowledged neglected tropical disease that causes a lot of suffering, especially among children. And you're going to learn more about Noma today from our panelists. Mrs. Tambe's narrative on Noma not only exposes the devastating effects, of this disease on the victims, but also underscores the indispensable role of journalists in amplifying awareness about diseases, and particularly neglected diseases. Nike's work stands as a testament to the power of journalism in shaping public perception and advocating for those affected by neglected health crisis. So with no further ado, Nike, I pass the microphone and the baton to you. Thank you.
All right. Thank you so much, Beatrice. Thank you. Good day, everyone. Good afternoon, good morning. Depends on your location. And I welcome you all to this very high-level event put together to discuss a very important topic, neglected tropical disease. So like B earlier said, my name is Nike Adebo-Wale Tambe, a freelance health journalist in Nigeria, and I'm truly honored to serve as your moderators for today's event. This discussion is happening at a very crucial time as the world prepares to commemorate the 2024 World NTD Day, which is 30th of January, and with a very powerful theme, which is to unite, act, and eliminate. I'll just give a brief overview on NTD. NTD, as defined by the World Health Organization, constitutes a diverse group of conditions, mainly prevalent in tropical areas, thriving among communities grappling with poverty. These diseases caused by various pathogens, including viruses, bacteria, parasites, fungi, and toxins, are responsible for devastating health, social, and economic consequences. It is estimated that NTDs affect more than 1 billion people globally, while the number of people requiring NTD interventions, both preventive and curative, is about 1.6 billion. These diseases are mainly referred to as neglected because they are often absent from the global health agenda, since they are often impact the most marginalized populations around the world. Even though many of them are preventable and treatable, they still cause a great amount of suffering and harm. And as most of us know, a recent addition to the list of NTDs is Noma, a preventable and treatable disease linked to malnutrition and unsanitary living conditions. While the acknowledgement of Noma as a neglected tropical disease by the WHO is a welcome development, it is very important to also note that there are still gaps waiting to be filled. And what are these gaps? Important strategies to completely eradicate NTDs. So to delve deeper into this very critical topic, we're privileged to have distinguished experts on the call with us today. So I think we should sit tight as we'll be learning a lot from them. Permit me to introduce some of our distinguished speakers to you. I'll start with Ms. Molly Brady of Althea International USA. Ms. Brady serves as a senior advisor for NTDs on USAID's Act to End NTDs East program. She has more than 15 years of experience in infectious diseases with a focus on strategic development and monitoring and evaluation of NTDs in Africa, Asia, and Latin America. She is a recognized global expert on lymphatic filariasis, also known as elephantiasis, a mosquito-borne illness that causes disfiguring, swelling of limbs and genitals. Our second important speaker on this call is Dr. Kavita Singh from India. Dr. Singh is the South Asia Director of Drugs for Neglected Disease Initiative, popularly known as DNDI, which is a drug research and development organization. Her career has been at the interface of clinical research, public health, and advancement of innovations for delivery. She has worked with the pharma industry, government, and non-profits. She is a trained physician with a MD in microbiology and a postgraduate diploma in epidemiology. Our third speaker is Dr. Ichmail Louisi from Tunisia. Dr. Louisi is a professor of medicine and immunology at the Faculty of Medicine of Tunis, University Tunis El Mana. Between July 2007 and October 2023, he served as Director General of the Pasteur Institute of Tunis, where he contributed to the implementation of numerous public health and research policies in Tunisia. Throughout his career, Dr. Louise has worked on more than 30 research projects funded by established international agencies. It is important to note that during the COVID-19 pandemic, Dr. Louisa also directed the Scientific Vaccination Committee in Tunisia and led the country's vaccination campaign. He is also a member of the Lancet Commission on 21st Century Threats to Global Health. And our fourth and last speaker for today's very important event is Ms. Marianne Compare from the United Kingdom. Mrs. Compare is the co-founder and director at the International Society for Neglected Tropical Diseases based in London. Ms. Compare has an academic background in development economics and prior professional experience in economics, statistics, and sustainable development. She has previously worked at the World Trade Institute in Bern, the emerging markets divisions in financial markets before joining the Economist newspaper as an economist and statistician. She is interested in multidisciplinary approaches and tools to tackle some of the world's most pressing development and health challenges, and has led campaigns, events, and evidence building across numerous neglected tropical diseases. She has lived in Jakarta, Paris, and London. So that is all for our speakers today. We have about 4 speakers on this call. So permit me to just go straight to save our time for today. I'll go straight to our first speaker, Mrs. Molly Brady. Are you here? Are you ready?
Yes. Thank you, Nikkei.
Okay, thank you so much. So can you give us an overview of RTI International and its works on NTDs globally? And where are we on the road to NTD elimination? Thank you.
Sure. Thank you. It's really nice to join this session and to see the interest in neglected tropical diseases. For those of you who haven't heard of RTI, RTI International is both a global research institute and a leading international development organization. And for more than 17 years, we've supported governments to deliver successful and cost-effective programs to control and eliminate NTD. In my role at RTI, I work on the U.S. Agency for International Development, or USAID's Act to End Neglected Tropical Diseases East program. And we support governments to reach their populations with treatment, to conduct surveys, to assess the impact, and to strengthen health systems so that NTD services can be delivered sustainably. To date, RTI initiatives have supported governments to provide more than 2.2 billion treatments, and our training and technical assistance efforts have allowed us to work with more than 75 countries to pursue their NTD goals. Nikkei, as you mentioned, while NTDs might not be well known, they do cause serious issues and impacting more than 1 billion people globally, causing billions of dollars of lost productivity each year. At RTI, we focus on 5 of the most prevalent diseases: trachoma, lymphatic filariasis, onchocerciasis, schistosomiasis, and soil-transmitted helminth infections. And these 5 diseases can all be addressed through the administration of safe and effective medicines to entire populations. And so being able to treat those at-risk communities for a number of years, as well as strengthening health systems and being able to provide clinical care, can result in the control and elimination of these NTDs. I do want to note that there are a number of other NTDs for which new research and therapies and funding is really required to address them. And I think some of my fellow panelists will share more on this later on. Christoph, if you could bring up the slides, please. I wanted to say a little bit about the success that we've seen in NTD elimination and control. 50 countries have eliminated at least one NTD, which is halfway to the World Health Organization's target that they set in their 2030 roadmap for NTDs. And we're seeing elimination happen in real time. In 2023, 6 countries announced elimination of at least one NTD, and Bangladesh eliminated 2 NTDs, lymphatic filariasis and visceral leishmaniasis. So I wanted to take a moment to acknowledge all of the people that are part of this work and what it takes to make elimination happen. So as you can see in this photo, decades of progress and dedication from community drug distributors are really the backbone of the work. This is a woman in Ethiopia who is giving out medicine for onchocerciasis. Next slide, please. Also critically important to the work are community social mobilizers, such as this man in Port-au-Prince, Haiti, who are telling people where to take the drugs, what the drugs do, and convincing them to take the medicines, as well as local leaders, elders, and mayors whose support is really key. Next slide, please. And beyond the distribution of medicines, we also have survey teams that are critical to this effort. This is a photo of a grader assessing trachoma in a refugee camp to determine whether the disease has been lowered enough that the distribution of medicines can be stopped. Next slide, please. And then we have teams like this one in Indonesia that need to collect blood in the middle of the night in order to accurately assess the prevalence of the parasite. So we're going house to house at midnight to collect blood from community members. Next slide, please. And a really critical part of the elimination effort is being able to provide care for people that already have clinical conditions related to these NTDs. So this is a photo of a clinician in Bangladesh who is helping teach a man with lymphedema how to do the daily hygiene routine that he needs for his legs. Next slide, please. And we don't want to forget the logistics specialists who make sure that the drugs and the diagnostics arrive where they need to on time, the program planners, the staff pulling the budgets together, the people that are getting the memos signed by the right people so that activities can move forward. Thanks, that's the end of the slides, Krista. So in short, it just takes a huge team with a variety of skills, all of which are critical to achieve these goals. And I think at the global level, a critical part of this team are the pharmaceutical partners who have generously donated medicines for the diseases that we work on at RTI has been one of the most successful public-private partnerships. So we've really seen tremendous success as health ministries have worked to understand the prevalence of these diseases, have scaled up these massive annual campaigns, have reached a lot of people. But some of the work that I'm doing right now on USAID's Act East project program is trying to treat the hardest to reach populations. So these might be individuals who work long hours away from home, they're migrating with their livestock. They might be populations living in insecurity or conflict areas. Sometimes they're areas far away from health facilities that take boat rides and motorcycle rides or walking to get to. And then also urban areas where people react differently to distribution and social mobilization approaches than their rural neighbors. So these challenges really mean working with new partners. In some places, we've started working with vets who have relationships with and access to pastoralist populations. In other places, with humanitarian agencies who are trusted and really know the situation in insecure areas. And then also in many countries with journalists who can inform communities about NTDs, can help respond and clarify misinformation. Personally, in my role at RTI, ACT and NTDs East program, as you mentioned, I focus on the elimination of lymphatic filariasis. And there are a few specific challenges that I wanted to note in the lymphatic filariasis space. One is that in certain places, we're seeing that the prevalence of disease, despite years and years of treatment, is not being lowered as expected. And so we're working with health ministries to understand who's not being treated. Are people being missed and not offered the drug? Are they refusing the drug? And how can we pilot new approaches to overcome this? Second, in parts of the world, there's some tricky filarial parasites and cycles of infection involve animals such as cats and monkeys. And so it's more difficult to interrupt that transmission. And then third, we need new diagnostics to more accurately measure prevalence of infection, particularly after the interventions have been implemented. And I think underpinning many of the challenges across many of the NTDs is this need for better medicines and better diagnostics. And so I'm looking forward to hearing from my colleagues on this panel, who I think will be sharing some specifics about several other of the NTDs. So thank you, and back to you, Nikkei.
Thank you very much, Ms. Brady. Thank you for such an elaborate presentation. At the start of the presentation, you mentioned that some countries have been able to eliminate at least one NTD, and you also highlighted the importance of collaborative efforts in actually eliminating NTD. So if I could relate this to, if I can relate this to the theme of this year World NTD Day, which says unite, act, and eliminate. This also highlights the importance of collaborative efforts. If we can come together to unite, work together, act by learning our voices in different ways, journalists, through your writing and all, and then we'll be able to eliminate NTDs, hopefully by the year 2030. Thank you so much. So I'll go to our next speaker now. Okay, to our next speaker, Dr. Kavita, are you here?
Yeah, thank you. Thank you so much. And Christopher, if I can request you for getting the slide deck on the screen.
Okay.
And I'll begin.
So I'll proceed to...
Yeah, go ahead.
Okay, yes, I'll proceed to your question. We just need you to tell us briefly about DNDi globally and its priorities in Asia. Can you also highlight some of the major challenges and advancements in treatment of neglected tropical diseases, please?
Sure, Nagi, I'm happy to do that. And thank you so much, Molly, for setting the context. It's so easy to build up on that. And thank you for the participants for your interest on this area, an area which we call neglected, but doesn't look like we have so many participants today. So in my, in the next 7-8 minutes, what I'll be doing maybe is like Nikki's advice, we'll talk a little bit about the organization, because it's Drugs for Neglected Diseases initiative, as the name indicates. The whole genesis of this organization is based on the fact that the diseases, a very particular upstream part of what Molly mentioned is, distribution, making sure that drugs are available, but also ensuring that proper drugs are, recommended for the diseases which we have categorized as neglected. So if you can go to the next slide, please, Christopher. Thank you. you would see that, in fact, DNDi completed 20 years last year. We were formed in 2003, and 2023, we had completed 20 years of existence. And this is one unique organization which was created totally in response by, when the clinicians got frustrated, when you don't have the right drugs to treat your patients, when you have unsafe, you have toxic, you have drugs who are, it's difficult to maintain compliance. But despite all these challenges, we were still not seeing the pharmaceutical companies, taking up the baton of saying, okay, let's make better drugs like we have for other diseases. And of course, we understand, as when you belong to this ecosystem or to this fraternity, you realize that these are not the diseases on which the private organization or the for-profit organizations would end up making money, because these are the diseases, as we heard from Molly and also from Nikki, that these are the ones which impact the poor of the poorest, the communities who cannot afford. So how would any for-profit organization get its money back? Or, when you're talking about elimination of a disease, so it means you will not be selling your drugs anymore. So how do you incentivize for-profit organizations? Therefore, the organization realized that it is that you need to have an alternate source, alternate way of developing drugs, and that's how this not-for-profit organization was born. And in fact, if I can go to the next slide, please. When it was created, the whole understanding, a very numerical understanding was that, can I go to the next slide, please? That
Dr.
less
Kavita,
than,
sorry. Dr. Kavita, just a
yeah,
reminder to speak a little slower for some of our speakers. Thank you. Some of our
sure,
panelists. Yeah.
sure. Just a very numerical number, which gives you the importance that a 12% of the global disease burden just had 1.1% of new drugs being discovered. So that's a message which I was giving, that you would not see much discovery happening for drugs, for treatments, for a disease, for a group of diseases which impacts more than 1 in 5 people. Can I go to the next slide, please? So therefore, that's what this organization did. And you realize, and just, I'm not transgressing my conversation, but just showing the long pathway of any drug R&D, which could be for profit, not for profit, but your standards of making the drug is same. So if you go from left to right, there's always a phase of discovery. Then there is where you really do your lab work, you do chemical synthesis, and then you go, if the drug looks good, the candidate looks good, you take it to the translation phase where you do a lot of in vivo studies, animal studies, early human studies, and if encouraging results are got, you take it to the next phase of clinical development. And that is large human. I mean, all of us are getting used to of clinical trials, especially since the COVID vaccines trials, we all understand. Then the large studies are done in these patient population group. And then, of course, you ensure that these drugs are available. They are registered in the countries that they undergo the proper regulatory review, which each country has, and which Molly already mentioned is, ensuring this drug reaches the patient. So all that comes. So you would see it's complex, it's complicated, and you need to work with partners at every step of the way. And if I can go to the next slide, please. And very similar strategy, of course, was adopted by DNDi. And this is a strategy many organizations who work in in the clinical, in the drug development space work in. That you do some, you can, if I, I'll take from right to left. Or just when you say short term, you immediately have drugs. So suppose a drug is available for a disease in one country and you register it in some other country, you make it available. These are some things you can do in short time. You can also work at times, making new formulations or new dosage formulations or new combinations, which is with existing drugs, which also takes about 3 to 4 years. But when you do long-term projects, when you start from discovery, then it can take anything between 5 to 8 years, 10 years, 11 years, even longer, because that's the time frame we all are aware of for new chemical entities. So this strategy of driving innovation has been adopted by DNDi also. And that's how you would see, if you go to the next slide, that in 20 years, what we have been working on different disease, and this is the global, the global foot map or global footprint. And I'm not sure, it's not very visible to me, and I'm not sure how much is visible to others. But just maybe I could just read out. You would see for visceral leishmaniasis, we work separately in Latin America, separately in South Asia, separately in East African countries because the treatments are different even for a similar disease. And I think the one of the biggest contribution has been for sleeping sickness, where you see the oral drug flexinidazole as a treatment for Gambians also, and now very recently in the last month, in the December of 23, for Rhodesians also. Malaria, as you would know, is now being taken care of by a very focused organization, malaria group, and DNDi does not work in the space of discovery or development of malaria anymore. Now, while giving this global picture, like Neke had recommended, I'm just going to shift a little bit of my gear and come to the region I come from, India, Bangladesh. That's this WHO South. Can I go to the next slide, please? The WHO Sero region. And you would see, Molly mentioned that they're one of their biggest program is Go East. And because the reason is because there is a huge burden of these diseases. And though it's an old data, it's taken from a very recent article published by WHO Sero office saying that in 2013, about 59% of LF interventions were from this region. Leprosy is a big problem, and so is soil transmitted helminthes. And what the table shows is that these 5 were really the diseases in this part of the world where public health interventions have been recommended. And you would see that they vary from preventive therapy to disease management, vector control, wash, and the surveillance, and of course, monitoring and evaluation. And of course, depending on if a disease is vector transmitted, like lymphatic filariasis and Kala-Azar, there would be a lot of stress or focus on the vector control. Can I go to the next one, please? And I'm going to just talk a little bit more about these 2 large countries, Bangladesh and India, there was a reference that Bangladesh has in fact been one of the successful early ones for 2 diseases, the Leishmania and the lymphatic filariasis. But if you would see that many diseases are prevalent in these 2 countries, and there's a range of viral, parasitic, in fact, the fungal and the non-fungal diseases which exists. Though India is considered as yaws free, and it has been certified to be yaws free. And what I see here is LF is of course a very recent elimination as public health problem. Bangladesh has also been very recently certified or validated as for leishmaniasis, as visceral leishmaniasis, as free from public health issues. You can go to the next part, please. I'll talk a little bit. I have another couple of minutes? Because LF was a disease which was mentioned by Molly also. And if I can go to the next slide, I'm not sure how many journalists have read a lot about LF, but if you can see the patients with elephantiasis, and it's of course this is a disease with a very complex life cycle. A life cycle which goes from humans to mosquitoes. How does the larva grow inside? How does it multiply inside the lymphatics? How does it come out in the bloodstream? A very complex pathway, and a disease which has a very high morbidity, which needs to be managed if you start suffering from the disease for lifelong types. And if you go to the next slide. While I mentioned that Bangladesh has been successful, but a large neighboring country, which I come from, India, just really want to give you this flavor of trying to appreciate that the country has been trying or making attempts to control the disease, eliminate this disease since 1996. And today we are in 2022. And continuously the country has been, the national control program of this country has been making, different strategies. So if you see, it started in 96 with a single drug as the mass drug administration, which started with few districts, scaled up, amplified to many more districts. And then gradually another drug added to the first, started with DEC, and then another drug was added to it, albendazole. And in 2018, another drug. So now today it's a 3-drug therapy, which has been given as a chemopreventive mechanism. And today, India, some districts are getting the IDA and some districts are getting the double dose, the 2 drugs, depending on what stage they are. So I was just trying to highlight that 2 neighboring countries with similar vectors, Bangladesh has been able to eliminate VL and LF, and India, though, is making lots of efforts. And just to wind up, I think my last slide is showing what is the status of this disease, which has such a high morbidity. And you would see that Indonesia, Nepal, and Myanmar, the three countries, have also adopted the IDA, which is the three drugs, while Bangladesh, Maldives, Sri Lanka, and Thailand have eliminated the disease as a public health problem. So I'll wind up with that, and I'm happy to take any questions whenever we have. Thank you so much.
Thank you so much, Dr. Kavita, for that. I'm sure we'll get questions and we'll get back to you soon. Thank you so much. So I'll just quickly move to our next speaker, please. Dr. Ichmai, are you here, sir?
Yes, of course.
Okay.
And
Thank you.
I'm very happy.
So
I'm very happy. Please?
Go ahead, please.
So,
yeah,
thank you. So I'm very happy to be in this event to share some data and some information on neglected tropical disease, and more specifically on Leishmaniasis. Please, Christophe, if you can put the slide. Okay, thank you. So I came from Institut Pasteur in Tunisia, in which I worked for more than 35 years, and mainly work on Leishmaniasis, which is one of the top neglected tropical disease, which is a subject of this event. And we will have this World NTD Day the next week. Probably I have to say some word on my institute because it's involved in many years. Now we have 130 years of existence, and we have a long tradition and different teams working on different aspects of Leishmaniasis, both human and animal, involving host, reservoir, and vector. As you will see, this is complex disease. And we have different approaches from the epidemiology, surveillance, vaccine development, or also drug development. So these activities are coordinated and are made in collaboration with many countries, thanks to our collaborators from North Africa, mostly Algeria and Morocco, but also India, from Europe, France, Germany, UK, and others, and also United States and Canada, among countries and teams with which we collaborate, with the support of different funding agencies, including NIH, WHO, the European Commission, and Fondation Mérieux, and other foundations. So Leishmaniasis is a typical neglected tropical disease. It affects the neglected population, and sometimes even within the same country, it affects the poorest population of these countries that are endemic for this disease. As you show in this slide, there is two forms. You have the cutaneous Leishmaniasis. I will show some figure later that affect many countries in the world. And also you have the visceral Leishmaniasis, VL. I want to point here that visceral Leishmaniasis is a fatal disease if not treated when it starts, when develop the symptoms. I say this because sometimes we have many asymptomatic infection. But if we have the symptoms for visceral Leishmaniasis, the disease is very dangerous and can kill the patient if not treated. So next slide, please. The cycle is between reservoir, or sometimes it could be between humans, but by the bite of a vector, which is a sandflies. The cycle is complex, and as I told you, we have two main forms, let's say, cutaneous and visceral Leishmaniasis. Next slide, just to show the appearance of the lesion. Here is some cutaneous Leishmaniasis, what is called localized cutaneous Leishmaniasis, but sometimes, as you see with this lady, it's a pregnant woman, and you know, during pregnancy, sometimes there is some what is called immune deficiency due to pregnancy, and even the parasite that usually induce a small lesion could affect and could induce some severe disease that need treatment, serious treatment. Next slide. I have other forms of cutaneous leishmaniasis. Here is due to Leishmania tropica, Leishmania and infantum in Tunisia. It's different species of the agent, which is Leishmania. Next slide. In the world, we have this form of Leishmania, which is Leishmania tropica. We said it's anthroponotic because there is no reservoir for this disease, animal reservoir. I mean, it's transmitted between human to human, but it sometimes induces a form that is recidivans, that could recidive with some healing in some place and sometimes reactivation. And this is the reservoir. The reservoir is human, and the parasite is transmitted again by the sandflies. Next slide, please. There is other forms in the New World, in Brazil and other part of Latin America, which is called mucosal leishmaniasis. It affects some places, and it could induce some severe situation. As you see here, one lesion, mucosal leishmaniasis in Bolivia. And the next figure here show sometimes the difficulty of the treatment, which still need intralesional injection of the drug, which is painful, and the drug is toxic. This is to show that we still need more drugs against leishmaniasis, and the NDI is doing many efforts for that. Next, please. And the last one is related to visceral leishmaniasis. There is no lesion, but the disease is affect organs like spleen, like bone marrow, like other profound organs. And as I told you at the beginning, this disease is fatal if not treated. In the region, the Mediterranean region, there is a reservoir, dog reservoir, but in other places in the world, like in India, in other part, also in Africa, the parasite is transmitted between human to human, and it's induce also the visceral leishmaniasis. Next, please. Now, I want to say some points that are common with other neglected tropical disease, especially those with a complex, let's say, cycle like leishmaniasis, in which we have vector. So one of the control measure and prevention measure is to reduce or interrupt the transmission of the disease when we use some bed net, for example, that is used in some places in the world to control human. So sometimes we have only to make an early diagnostic and a good treatment, but it's not easy, as I will show you later. And for this disease, especially for the species of Leishmania for which there is a reservoir, we can act on the reservoir, but again, it's very complex because it should be adapted to the local situation and to the reservoir. Next slide, and I will show that there is therapeutic difficulties. There is no many drugs for leishmaniasis. There is some effort in recent years, but we still need drugs because sometimes it's the cost and the drugs, there is some toxicity, and there is more and more drug resistance. And this is why we think that the vaccine and vaccine development against leishmaniasis, it could be a solution, and it could be something important, but we still need more, let's say, information, and especially probably clinical trials in order to better understand and to go in the good way for vaccine development. Next slide. Why? Because in this disease, like for other disease, the infection or the disease could induce some resistance. So it's immunizing. And in the past, there is a practice for many centuries, which is what is called Leishmanization. It's a deliberate inoculation of the virulent Leishmania parasite in a place that is not apparent, and it could induce sometimes a lesion, of course, but it confers some protection. But now we know that the vaccine is feasible because there is an immune response that is developed after natural infection. There is many effort in vaccine development, but I want to mention for this disease the effector mechanism. You know that there are some antibodies that can act. There is cellular immune response. And for Leishmaniasis, the effector mechanism need the cellular immune response, the cellular arm of the immune system. And it's not easy to induce the good cellular immune response against a specific target. But there is a hope recently with different models, with especially the development of technologies. I want to mention especially the technologies of mRNA vaccine that is successful for COVID-19, and especially we know that it could induce a cellular immune response in general against a specific target. So we hope that with this new technology, we can induce artificially some immune response against specific targets that are specific for the parasite. There are many well known now and used with different and developed by different teams that work on immunology of Leishmaniasis and vaccine target and vaccine development. And there is a hope to develop a vaccine that could protect some forms of Leishmaniasis in humans, and also for some animals, like for dogs, for which there is a vaccine, but not completely, let's say, protective. And we hope to promote and to develop this kind of tool, thanks to the different effort of the world, especially for the mRNA vaccine with the WHO and Medicine Patent Pool and others. There is some collaboration in this field. And I want to emphasize the fact that Institut Pasteur in Tunis and other institutions and team are now collaborating, doing research activities in order to develop the mRNA vaccine against Leishmaniasis. And I can tell you that there is some promising preliminary results that are produced at Institut Pasteur in Tunis, but also in other institutions, that indicate that we are in a good way for the development of vaccine against Leishmaniasis. Hopefully, this will help to better control of this disease. And I will stop here. Thank you very much.
Okay, thank you so much, Dr. Ishmael, for speaking elaborately on this. And thank you for also highlighting the importance of vaccine development as a more sustainable and preventive approach to tackling this disease. So quickly, I'll go to our last speaker for today, Ms. Miriam. Can you please tell us about Noma? Noma is the recently added disease to the list of neglected tropical disease by the WHO. Can you tell us about Noma and dengue? And also, can you highlight the role of health journalists in enhancing advocacy for NTDs, please?
Absolutely, Nika. And can I just start by saying a really big thank you for including us. The run-up to World NTD Day is all about shining the spotlight on neglected tropical diseases. And I can't think of a more wonderful opportunity to share and also to learn from our colleagues in journalism, in health communications. So a very big thank you. To answer some of your questions, I do have a few slides ready, which I will attempt to share, I hope, successfully. Yeah, wonderful. And I suppose the first thing I'd like to do, being the last speaker, is maybe bring a bit together what my colleagues have been talking about over the last few minutes. And really, there's one very strong message when it comes to neglected tropical diseases, which is a group of over 20 diseases. And to illustrate that point, I'm just hoping my slides have moved. I always like to start with this very simple graph. I don't think an academic supervisor would be very happy because I'm not exactly comparing like for like when it comes to incidence and prevalence, but the point is really what is most important and will stand out. Some, very recognizable diseases here that I'm sure a lot of the participants on this call have reported on. And just to give a context to neglected tropical diseases, so thinking about cancer, for example, and HIV/AIDS. So every year we would see about perhaps, let's say, 40 million cases of HIV worldwide. When it comes to cancer, roughly 50 million, malaria, a much higher burden, 220 million a year. And then when it comes to neglected tropical diseases, which perhaps not on this call, but just in wider health and just more general global forums aren't always very well known, we're looking at over 1.2 billion people affected. This bar really dwarfing all the others, and this remains, despite all the wonderful achievements and milestones that we've heard about on this call and over the years, there still remains a big imbalance here. And what this means is that tropical diseases that affect more than 1 billion people in over 149 countries really are still not getting the attention they deserve. So I would say when thinking of these diseases, that must be and must remain really to talk about them, to make sure that people know they are there. I've got some figures that are similar to the ones Dr. Kavita mentioned earlier. It looks at a slightly different time period, but what that means in practical terms is that out of, let's say, over the last decade, over the myriad of new therapeutic products registered, only 4% have indications for neglected diseases. And it is still really striking that under 10% of spending on health research goes towards improving the understanding and tackling the global disease burden that affects over 90% of people worldwide. So within that broad context, and I think that was the first thing that we wanted to highlight, is that as a group, as a whole, we must keep talking about neglected tropical diseases. We must keep shining the spotlight on them. I just wanted to focus on two very different diseases within this list of 20 plus. And thank you, Nike, you mentioned Noma and dengue. And so we'll take a closer look at that. How should we talk about these diseases? What are the differences when it comes to advocacy? So Noma, and I do urge everyone to read Nike's very moving report, actually, from the Sokoto Children's Hospital in Nigeria, the Noma Hospital. What is Noma? So very briefly, as I only have a few minutes, it is a gangrenous disease of the face and the mouth. And what that terminology hides is really a very devastating disease that tends to be fatal in 90% of cases, or a very high percentage of cases. You might be surprised to hear that it's fatal in a bit over 2 weeks or a few weeks. And the survivors who do overcome Noma are then left with very deep, very long-lasting psychological and social sequelae. There is a Noma paradox, and which is that people didn't really know about Noma. Even very established professionals in the global health field might never have heard of it. If you had Googled Noma about 5 years ago, first of all, your computer would put that red line because surely you would have misspelled a completely different word. And you may only find a reference on the 6th page to the disease Noma. And the paradox being that it wasn't really well known, which led to insufficient research, insufficient funding, which leads to it being even more neglected. So kind of this cycle of neglect. The advocacy needed in such a case, and I think that's really where journalists, health communicators have an immense role, is quite simply to just keep talking about this disease and really bring out the personal aspect to it through interviews, case studies. It could even be through film. There's really a whole range of approaches there. And in the case of Noma, as you may have heard, at the end of 2023, right at the end of December, this was added in this milestone moment to this very official list at the highest level of WHO, and that we hope will bring in a new era for Noma, leading to more resources, capacity building, but also beyond that for the communities affected as a real gateway to improving healthcare across the board. So that would be one aspect of communicating in terms of a very, very neglected public health approach. It's really about making sure people are aware of this disease. And there's the whole range of tools that as journalists are there. At the other end of the spectrum, I thought it'd be really interesting to compare and contrast that to something like dengue. Dengue fever affects or puts at risk, over half the world's population. It's the world's fastest growing vector-borne disease, and it does, when an outbreak happens, it has the potential to completely overwhelm local health systems. This photo, which is taken in Bangladesh, and really shows the lack of hospital beds. And the response in a lot of countries has been left very kind of reactive to an outbreak. Some have even wondered, will dengue be the next pandemic threat? So when it comes to dengue, in complete contrast to Noma, it seems that it has been reported a lot in the news. It's linked to a lot of different issues, whether that be climate change, innovation in vaccines and treatments. And so the role of the journalist at that point might be to make sure that the innovations and the way we speak about dengue remains very factual, very relatable to communities, because when you're thinking about the word cloud around dengue, when it's vaccines and community engagement, also climate change, those can be slightly polarizing topics. So they're very different ways in which health communicators and their networks can help to highlight and drive this advocacy for neglected diseases. Every disease comes with its own challenges and parameters. So, of course, that would have to be tailored. But I thought that those two examples really showed a different range of how to maintain this focus and attention on them. Of course, all this is in a wider network. I just wanted to put out a few images of neglected tropical diseases, not having the time to go into detail into all of them, but clearly, if we go around this slide, we can see issues about neglected diseases that can be anything from the very practical, such as lack of adequate footwear or water and sanitation that needs improving, but also themes and issues around urbanization and this very deep inequality, such as in this image that I love and hate at the same time, taken in Sao Paulo, where you see luxury flats bordering on the favelas. And very importantly, in the top right corner, this intrinsic link of communities with their livestock, or maybe dogs that don't really have very established ownership, which means that a neglected disease such as rabies can go really unchecked. So lots of very different themes and spheres and issues to connect and to unpack when speaking and writing about neglected tropical diseases. And as you can see, really intrinsically linked to human, animal, and environmental health, and all these different areas, angles, and approaches that we can use and look at to talk about neglected diseases are come very nicely under the umbrella of One Health. And we would hope that, although it can sometimes be, despite the best of intentions, very difficult for the scientific community to come out of, as we say, silos or disciplines and work much more in partnership with each other, it is really a wonderful boost when health communicators can just make sure that that lens keeps being applied to all these problems. So just by way of conclusion, I only have a few more minutes, but I hope that ICE-NTD can be a good partner to everyone who's interested in tropical diseases. I've just thrown a lot of images here because we do a lot of numerous and varied things. Starting from the bottom, we do have conferences and webinars on lots of the issues that I sort of raced through in the last few minutes. We have a YouTube channel. This may interest you. Now back to the top of the slide. We do run an annual festival which brings together science communication, the creative industries, and global health. I've put an MTV logo there because we try to work with very exciting and diverse partners. Perhaps you've heard of or even seen the MTV Sugar program. We also try to bring in people like Google or IBM, Unilever, just really a very varied and wide range of partners. And finally, please, if you would like to find out more about any of these, we do have thematic conferences, whether it be on water, sanitation and hygiene, or climate change, vector-borne diseases. Those happen once a year across themes, and we also have more informal weekly webinars on all sorts of topics around tropical diseases. Many of the recordings are on our YouTube channel, and they are free to attend. So by all means, do reach out, whether to ourselves, to any of the partners on the call, or just to the NTD ecosystem at large. We are very multidisciplinary, very collaborative, and I think it's safe to say that it's very close to everyone's hearts just to make sure that this spotlight remains on neglected tropical diseases. And you have my contact details there as well. So just to round off, I do wish you a happy World NTD Day coming up. The strapline this year, the theme is to unite, act, eliminate. Health communicators are absolutely essential, whether it's in improving the understanding of the disease, sharing the latest research, but also really making sure that NTDs remain relevant in a much wider context of global events. And so for that, I thank you very much for your attention, and I'd be happy to take any questions or hear comments from the audience. Thank you, Nike.
Okay. Thank you so much, Ms. Miriam. That was quite educating. Thank you so much. Thank you to our participants. Thank you for staying on the call. And this is to let you know we're going to be given about 15 minutes for questions and answers. So if you have your question, feel free to drop them in the chat box. I'm sure there are a lot of questions to be asked because personally, I've gotten like a lot of story ideas from this, from importance of vaccine development to available treatment options, high cost of treatment, access to improved healthcare services, and improved financing, and so much more. These are some of the angles my colleagues here can actually explore. And like I said earlier, this discussion is coming at a really important time. We have about 5 to 6 days to the 2024 World NTD Day. Though it's just 5 days, but I think it's actually a long time to come up with stories. It can be analysis, features, special reports, one-on-one interviews with experts. Those are the kind of reports you can actually publish ahead or on the World NTD Day. And also to let you know that our speakers here will be available for one-on-one interviews after today's session. I'm sure Catherine will drop their email addresses or phone contacts, and you can also connect with her to get further access to the experts today. Thank you so much. So now we'll go to our question and answer section, please. A minute. So our first question here is from Chibuike from Nigeria Health Watch. He said, I'm curious to know if there are any resources that document or articulate how the countries that Dr. Kavita mentioned eliminated certain NTDs. Dr. Kavita, this is for you. Do you want me to come again?
No, I got the question.
Okay, please,
So I mean,
just go
yeah,
ahead.
it would be great for, journalists like you to really interview people and come out with those reports. But what you can certainly get, from the country's national programs website is their elimination. So every country, if you go to India's, there's a National Center for Vector-Borne Disease Control, a website. You would get the whole documents on how they have planned the roadmap for elimination. How they're going to tackle the vector, how they're going to tackle the disease, how they have categorized the disease, what treatments they have recommended. Similarly, for Bangladesh or other countries. But I would say this is an excellent type of a journalist question, which you're expecting that what are those things which were done differently for similar diseases between countries to see the variation we see today, so that to imbibe the learnings from who have been more successful or who are still on the way or who are still behind. But you can certainly get from the national programs websites all their elimination program strategies which they adopt.
Okay, thank you so much, Dr. Kavita. Do we have any more question here? Please feel free to raise your hand. Just tap the hand icon there if you have any question to ask, please. Colleagues, journalists, this is an opportunity. Don't miss it, please. Kindly ask your questions. We still have about 12 minutes to go.
I have a question. May I ask a question, Nike?
Yes, please.
I have a question for any of the speakers on cost of eliminating these diseases. Was any mention, because these diseases for the most part are treatable. So is there any bulk figure on the kind of investments that the global health community would need to make in order to really eliminate these by 2030? Over.
Okay. Dr. Ichmai, can you please respond to that? Dr. Ichmai, are you on the call? Miss Marianne, please, can you? I don't think Dr. Ichmai can hear me.
Sure. So some figures exist per disease, not sufficiently, and the ones that do exist tend to be contested. The great news is that at WHO there is a new director for the Department of NTDs, and one of the missions I think that has been set out at WHO right from the start of this new tenure is to answer your wonderful question, Bea. So I only have a figure, but we're working on it.
Great, thank you so much. Keep an
Thank you so much.
Out. Thank you.
Okay. Does that answer your question, please? Okay, so I have another question, but I think this is for me. Nike, what challenges and successes did you encounter when you were reporting on Noma? So I'll just go briefly on the story I did on Noma. A story was published like early December 2023, I think either 8th or 9th of December. And coincidentally, about 3 or 4 days after, the WHO included Noma to the list of neglected tropical diseases. Okay, I think a major challenge I actually encountered working on the story is the availability of data. Nigeria, just like many other African countries, lack data on really important and specific health issues, including Noma. I had issues getting data, and you'd notice that some of the data I actually used, local data, some of the data I actually used way back, like 2090s and all, because we don't have data from like like 2015 till date, there are no really much data on Noma. And this is not surprising because we've always advocated for Noma to be included in the list of neglected tropical diseases. Even if that took a while, we've always assumed that this is one of those diseases that are actually neglected. People don't know much about it. As a matter of fact, I have to be sincere. If I wasn't reporting else, or probably I wasn't doing some research, I won't get to know about Noma. I actually saw it one of the times I was going to research, and even while I was trying to check for other reporters or journalists that have done same, I noticed that very few have done, one of which is Nigeria Health Watch, an organization in Nigeria here, but even other African countries, very few journalists have done anything on Noma, on neglected tropical disease. So absence of data was one of my major challenge. The second one is visiting the northern states, which the story was. I'm sure some of you are aware of the insecurity challenges in Nigeria, banditry, kidnapping, and all of it. I was actually scared. That was I had to go with someone that was like from the northern part. We went together to work on the story just for security reasons. So insecurity is another challenge apart from absence of data. Then I won't say non-availability of or inadequate experts. I won't say inadequate experts because while I was doing the story, at first I thought I wasn't going to get enough experts to speak with, but in the course of the story and towards the end, I actually got about 2 or 3 experts. But again, I was able to get these experts through Nigeria Health Watch. This is tell you that not many people are actually speaking on neglected tropical disease. And this is also posing a challenge to my colleagues, myself, that we can do this. We are journalists, we're the voice of the people. Our role is actually to pass out the information out there, advocate for policy change, speak about these diseases, and just create awareness on it, educate the public on it generally. And I'm grateful for an opportunity like this because with experts coming together and my colleagues like this, we've been able to learn 1 or 2 from you and also for the open opportunities to also contact you after this training. So personally, and I'm looking forward to doing more stories on NTDs, not necessarily Noma, because we have about 22 NTDs, 21 to 22 NTDs. So there are lots of topics we can pick from Borrelia, ulcer, to elephantiasis, and there is a long list that we can actually pick from and work on. So I'll just stop there, and also to encourage my colleagues, like we can do this. I know journalism it's actually not easy, especially if you're from the African region of the world. Journalism is not easy, but we just have to keep trying our best, keep advocating, and hoping that we get results on that. Thank you so much. So I think, is there anybody here? Okay, excuse me, please. I'm trying to get more question. Okay, I'm not sure this is a question. Catherine, is this a question, or Katarina? She said there's really a good book on okay, I think she's just making a statement. She said there's really a good book on NTD elimination called Under the Big Tree by Ellen Agler. So I think it's something we should try to read up. Personally, I'll do that, and I'll also encourage my colleagues to do that. Please, do we have any more questions, please? Okay, we have about 3 minutes to go. Do you have any more questions for now? Okay, no, please permit me to pass the mic to Beatrice.
Yes, thank you so much, Nike. Thank you so much to all the panelists. And first of all, thank you for your excellent moderation today, Nike. It was really great to have you and to also hear your challenges in covering as a journalist NTDs and this issue about lack of data. That always seems to be something that we come up against when we do in-depth stories, especially on certain health issues. I also want to thank RTI International for co-hosting this event with us today. It's really good for the Health Journalism Network and Internews to partner with NGOs that focus on global health and to really access also the experts that dedicate their lives to covering diseases and advancing global health for everyone. And I also want to thank all the panelists for making time to be on this panel today and to shed light on diseases that really need to have a lot more focus on in the media and in our consciousness, really. So especially thank you to Dr. Heshmi from Tunisia, and also Marianne from the UK, and Dr. Kavita from India. Thank you very much. And also Molly from the US. So we will connect again. This recording, we will send you the list of participants, and we will send the recording around. If you can send us your slides, perhaps we can share them with folks. And the recording is also going to be available on YouTube, Internews, the health journalism playlist. Christophe is going to fold the recording into our playlist under Internews, where all the health webinars are kept. So thank you very much once again, and thank you for all the listeners for joining us today. Bye-bye.
Okay, thank you so much. Bye.
Bye-bye.
Thank you.
Au revoir.